So let's learn today how to calculate expected date of delivery from LMP. LMP is last menstrual period. So last menstrual period is normally calculated from the very first day of her periods. Whenever she started bleeding, the very first day of her cycle is called as LMP. And EDD, that is expected date of delivery, is calculated using a formula called as Naegele's formula. So this formula says that you add 7 days and subtract 3 months from the last menstrual period. So for example, a woman, and something which is very important to remember is that this formula works only in a woman who's getting her cycles regularly. So if her cycles are between 28 to 30 days, regular cycles, then this can be utilized in such patients. Now, say if a patient has got her last period on 1st January and we want to calculate her EDD. So EDD is 1 plus 7, that is 8th, and January plus 9 months. So 1 plus 9 is 10th. So her EDD will be 8th of October. So 8-10 will be her EDD. The other way of utilizing it is actually you add 7 days and subtract 3 months from the LMP month. So say if a woman has got her periods on 1st of December, so you add 7 days, so it becomes 1 plus 7 is equals to 8, and from December 12 you minus 3, that becomes 9. So her due date will become 9th of September. So you can either forwardly calculate it by adding 9 months, or you can subtract 3 months, but you have to add 7 days to the last menstrual period. Now what happens, many times patient cannot recollect her last menstrual period. So sometimes you might have to ask her if she can recollect any event, say घर में जन्माष्टमी था या गणपति था या कोई शादी थी, तो very reliably she can come, at least reasonably well she can recollect, हाँ ये वाला event था और उससे वहाँ पे ऐसा था. And many times in case her cycles are not regular, so a previous early ultrasound comes very handy, because early ultrasound relates to the expected date of delivery very well. And another way, say in case she is in a rural area where ultrasound facilities are not available and doctor has done a PV, a bimanual examination to confirm her pregnancy, even that finding is very reliable if it is done in a very early stage of pregnancy. So if the doctor has written 8-week pregnancy, then it is a very reliable source of information for us to calculate the expected date of delivery. Now, important thing here to remember is that actually only 4% of the patients actually deliver on the due date. Most of them will deliver in last 15 days. So it is not that EDD, and normal duration of pregnancy is 280 days. So all the calculations are done considering that the ovulation occurred on 14 days and those 14 days are added into the pregnancy. So actual pregnancy is 266 days, but EDD is 280 days, and all the calculations in obstetrics are taken from the last menstrual period. So normal pregnancy duration for us is 280 days. I hope this small video helps you understand how EDD is calculated.